Hi, it's Carmen Rawls with CR Consulting, World Religions for Healthcare Professionals, and today I'm going to talk about modesty. Have you ever gone to the hospital and had to put on one of those really uncomfortable gowns where you don't know how to tie it, or it's open in the back and your buns are out and you're having to walk around the hospital? Modesty is not just about world religions or religious practices. Modesty is sometimes just about wanting to be covered and feel secure, and to not have anxiety about what you have to wear when you're in the hospital. However, my focus is on world religion, so I'm going to talk a little bit about that. A study by Dr. Karen Scheinberg Andrews found that Latina women or Hispanic women have a sense of what is called pudor, Pudor, and that word is a Spanish word that means shame. And so it is a sense that certain parts of the body should not be exposed. It's actually related to the Latin word pudendum, which means the genitalia. So having the genitalia and breasts exposed is something that many women feel very uncomfortable with, and that causes them to be less likely to get personal physical exams unless they can be in the presence of a female doctor or at least a nurse or someone to be with them so they're not alone. The same thing is true with Chinese women. In another study that she did, she found that when there were publicly organized opportunities for mammograms, that when there were more doctors doing the exams that were male, the female patients didn't come. However, the following year, when they had more female doctors, more women came and got their breast exams and mammograms. So that was an increase and an improvement for their lives. The same thing can be found true among Orthodox Jewish women and Muslim women, who tend to cover everything except their faces. Some Muslim women also cover their faces, but the hair, long sleeve blouses, long skirts or pants, these items being covered, these women don't feel comfortable uncovering in front of male doctors, and particularly if there's not a female nurse or aide or some other person around them to help them with this. Now, as I mentioned, I think I mentioned that this is not always related to religion. There are companies that sell longer gowns that close completely, that may have slits or pockets for access if a person has to walk around, but they're designed so that the patient feels comfortable and covered. Also, a lot of male patients feel more comfortable with a male doctor in terms of exams like urology exams than they do with a female doctor. So in that case, it's not necessarily about a religious belief, although it could be tied to one. But the thing is that they would just feel more comfortable with a male doing those exams for them. So why don't healthcare providers necessarily think about modesty? Well, what they found is that some of the things that they're concerned about is the time it takes to provide this, the finances, the money it takes to provide this, and also a sense of not being aware of people's practices, religious and cultural practices. So what can they do? What can healthcare providers do? The first thing is to take the assessments like I talked about before, so that you can find out what the patient really needs to feel comfortable and to have a decrease in anxiety over their exams. If a same gender person is not available to do the exam, it would at least be helpful to have another person there of the patient's gender, so that they feel that they have some comfort, some company, and someone to just kind of watch for them to make sure that everything is going along as planned. The other thing that they can do is to try to talk to the patient to relieve their anxiety. Sometimes in emergency situations where it cannot be worked out that a person of the patient's same gender is there, it's just best to talk to them and explain everything that's going to happen, what's going to be done, why it's going to be done and how it's actually a life-saving treatment, or a very important treatment, so that they can feel more relaxed and have a chance to just say, okay, this is an issue of health and we're here to get better. So there are a lot of other religions that I'd like to cover in terms of talking about modesty, but I just wanted to give you a little bit of a hint about why some of these things are important, so that healthcare providers can help their patients to feel safe, comfortable, and to respect their needs and wishes. So I will talk to you soon. Take care, and thank you so much. Take care. Bye-bye.